Great. Well, welcome to our third and final installment in our deep dive series of webinars on our priority bills. My name is Nora Bent, and I'm the Director of Government Affairs and Strategic Partnerships here at the ARC of Massachusetts, and really happy to be here with all of you today for this webinar. I will just give a quick caveat that I'm getting over a cold and my voice is a little funky, so bear with me today and apologies if I have a coughing fit. We're going to go through our bills in this category today, but before we get started, I just wanted to quickly acknowledge the passage of the federal reconciliation bill last week that will make really significant and devastating cuts to Medicaid and related programs. This is something that the ARC is incredibly concerned about and has been advocating against for many months. We're not going to go into a lot of detail on it today, just in the interest of time and wanting to stay focused on these bills. But do stay tuned. In the next couple of days, we'll have a full analysis up and some information on our next steps. And when we get to Q&A later today, if anyone has a really urgent question on the bill, I'm happy to answer it. But we're going to stay focused on these bills today and some uplifting work that we're doing here in the state in this really scary moment. All right. So before we get started, I just want to give a quick shout out to our agency sponsors here at the ARC who make this and all of our educational webinars possible. And as I said at the top, this has been a three-part series where we've gone through each of the categories in our bill platform. I'm going to talk a little bit more in a minute about how we set our priorities this session, but we took our 14, 15 priority bills and divided them into these three different categories: uplifting the workforce, health equity, and community inclusion and empowerment, as a way of organizing our bills for our community legislators, kind of keeping them organized. So we've been walking through all of them in this series, and since today is the last one, soon after today's conversation, we'll have the recordings and slides of all three webinars available. So we'll send those out and they'll be on our website, so stay tuned for that if you missed one of them or want to go back and rewatch one of them, because it is a lot of information. But for today, we're going to be focusing on, again, that community inclusion and empowerment category. But before we get into that, I want to give just a quick refresher on our priority setting process, how we got here, a quick overview of the legislative process, just to give some context as to where we are at this moment in the session. Then I'll go through the bills, we'll talk about advocacy and resources, and we'll have lots of time for questions. Feel free to put questions in the chat throughout, and if I start coughing, I might pivot to questions to give me a break, but we'll take all of them at the end as well. Okay, so how did we get here? As folks might know, in Massachusetts, we operate on 2-year legislative cycles, and one just began this past January. So at the end of 2024, in the fall and winter, we were preparing for this new session to begin in January, and really took a step back from our bills and our priorities of previous years to think about what still felt really relevant and what was top of mind for our community. So some of you may have participated in our community survey, which about 600 people filled out to share with us what was top of mind. What are the issues that you're thinking about for yourself or your loved ones? What bills have we worked on historically that still feel really relevant, to kind of help us rank and prioritize where our focus should be for this session. We also took into account the priorities of our chapters. As you know, the ARC has 17 chapters across the state that are providing the direct services to individuals and families. So hearing from them what's happening on the ground and what is really important to their community factored into this as well. And then, of course, both the state and national landscape, particularly in this current moment with so many cuts and changes coming from DC, really wanting to be realistic about what's possible here, thinking about potential financial implications on the state and where that shakes out with our priorities. So the picture on your screen is our attempt to capture all of this information and plan out our agenda for this session. And for the most part, these are the bills that we'll be working on through the end of 2026. And we're at this really critical moment right now in the legislative session where bills have been filed. That happened in January. They've all been sent to a committee. So bills go to a committee based on subject matter where they have a public hearing. Individuals can offer testimony. Many of you on this call have offered testimony already. And then the committee takes all of that and essentially decides what to do with the bill, how it moves forward. So for about half of our bills so far, we've already had a hearing, and we are actively working with the committees on all of those bills to make sure they move forward. So this is a really key moment of advocacy, but it is by no way the end of the process. There are many, many steps to come with advocacy needed, but looking a little bit different at each step in this process. I'm not going to go through this in a ton of detail today in the interest of time, but if you are interested in learning more about this, let me know and I'm happy to chat. We're also offering an advocacy training where we go through this really step by step to feel comfortable and empowered in the advocacy space. But for today's purposes, just know that we're at the start of the process, having hearings and seeking your input and your advocacy. I'll just put a bug in your ear that at the end of today's presentation, I'm going to be asking for folks to think about what bills are really meaningful to you that you might want to get more involved in if you're not already, and to let me know what those are so we can really quickly give you a call and say, hi, I know you care about this bill. The hearing is in a couple weeks and we want you to testify. So I kind of have that in your head as we're going through today. But to transition to our topic today is this category, community inclusion and empowerment, which is our set of priority bills that we'll be talking about today. As I said earlier, the other two were around the workforce and health equity, which are obviously so critical. But to me, this one really takes a broad look at everything else that touches our lives and asks the question, how do we ensure that folks with IDD and autism are able to participate, thrive, and be safe in their communities whenever possible? And that for us really means thinking about housing, education, reliable and accessible transportation, technology, support for the whole family, and employment. And all of our bills in this category really touch on this issue, but I think this is an important place to point out that these three categories, workforce, health equity, and community inclusion, are broader than just our bills. So this is really our priority for all of our government affairs work at the federal level, policies and regulations. So you're not going to hear anything today about a bill having to do with transportation, let's just say. But we're doing a lot of other work in that space that's maybe not through a legislative vehicle, but through our work with the governor's administration. So this work is broader than just the legislative agenda, but today we're going to focus on that legislative piece. Any questions before I jump into each specific bill? Okay, great. All right. Our first bill up, I'm going to talk through the quick summary of it, and then I'm going to turn it over to my colleague Jonathan, who is the co-chair along with me of the coalition that supports this bill. And I see a few other folks on this call, including Javon, who are part of the coalition. So nice to see all of you. But this first bill is around supported decision making. And quickly, I'll just say that on each of these slides, you're going to see on the right-hand side the bill number and the title and the legislators who lead on it. And we'll also share all of that out with you afterwards. But this bill is all about allowing adults, including folks with disabilities and elders, to maintain their independence and dignity and rights by choosing supporters to help make decisions about their own lives. This is an alternative to guardianship, not a replacement for folks who do need that level of support of having a guardian. But for folks who maybe are capable of making their own decisions with support, this would be a really viable option. About 20 other states and DC have already passed some sort of a supported decision-making model. And our bill here in Massachusetts would hopefully add us to that list by having a memorialized agreement in writing that clarifies roles for both the decision maker and the supporter, creating protections to make sure that this model is used appropriately, training for all users, and then some requirements about making sure that people, when they turn 18 and they're in their IEP meetings, are given this information to be able to make this choice if supported decision making is right for them. This bill has been around for a couple of sessions, so we're hoping to move on it this session. We are really lucky to have a support of the Massachusetts Advocates for Supported Decision-Making Coalition with about 20 individuals and advocacy groups who are involved with pushing this bill along. So with that, I'll turn it over really quickly to Jonathan, who will talk a little bit about his experience with supported decision-making, why it's important, and maybe give a little plug for the coalition.
Thank you, Nora. My apologies. I haven't slept well in a couple of days. Uh, support decision making is important to me because it lets me stay in charge of my life while having the support I need from the people I choose. As someone who happens to have autism and also a cancer survivor, I faced a lot of situations where people could have taken control over my decisions. But support decision making gave me another way. Instead of guardianship, I got to build a team of trusted supporters who help me think through decisions, ask questions, and make sure my voice is always respected. Support decision making helped save my life during cancer treatments by letting me decide how I wanted to go forward with the support of people who believe in me. I've experienced what it's like to have no control. I had a lot of trauma during my school years when I was younger. Um, that's why support decision making is means so much to me. Support decision making gives me back my dignity, my voice, and the freedom to grow into the person I am today. To me, support decision making is not about letting someone make all their decisions alone. It's about supporting them and trusting them to lead their own life. I believe everyone has the right to be heard, to be respected, and to evolve as human beings. To me, supported decision making is about dignity, freedom, and support, not control. Everyone deserves the chance to live their best life, no matter their disability communication style or supports need. Everyone should have the right to make choices about their own lives.
And maybe just talk about the coalition a little bit.
Sure. The coalition is filled with some of I would say, really good advocates and some of the best I've ever met in a long time. For example, Javon, who's here, really good advocate and really handles himself really well in there. And the thing is, it's what? Oh, you mean this? Oh, my apologies.
You're doing great.
Uh, Being a co-chair of the Support Decision Making Coalition gives me strength and purpose. I'm proud to be part of a group of advocates, supporters, and allies who are working together to make real changes. We all work together on the coalition, and everyone's voice matters. Together, we are bringing our voices directly to legislators to show them what support decision making means to us, and we together will not stop until it becomes law.
Great. Thank you so much, Jonathan and Nancy, as well, for being here today and for all your support and leadership on this bill. I think this one's such a great example of that kind of community support and grassroots organizing. So in particular, if this is one you're interested in or you currently practice supported decision making or are interested, definitely let us know and we'd love to loop you into the advocacy. I'll just quickly emphasize on this again, it's not an alternative to guardianship, that people can still choose that if that's right for them. And people can practice supported decision making now, but there aren't really any regulations around it to make sure that it's done correctly and safely for the individual and that it's recognized. So you might practice it walk into a bank and try to do something and they don't recognize it. So we want to make sure this bill is passed so that anyone, regardless of where they are in the state and who they happen to get, maybe at the bank or at the doctor's office, understands what this is all about. Any questions on this one before we move on? Okay, great. I do feel like each of these could have their own webinar, so we are going through pretty quickly today in the interest of covering all of them, but happy to connect. I'm sure Jonathan is too on this bill offline if you have other questions or want to get involved. Okay, go to the next slide here. All right, so the next two actually are about police interactions and law enforcement interactions with folks with autism. So the blue envelope bill, which actually Jonathan is also a great advocate for, as are many folks on this call. Jonathan, I feel like this is your category, these bills. So this bill, folks actually may already have a blue envelope. It's an envelope that you can request that can include your driver's license, registration, information about your triggers or challenges or emergency contact information that you as a person with autism who's driving or as someone who often drives with someone with autism in the car can keep in your car in the event of a traffic stop. So this really helps to facilitate understanding, communication, and safety between law enforcement and people with autism and their families. As I said, you may already have one because the state police thought this was such a great idea that along with the ARC and Advocates for Autism of Massachusetts, they designed a blue envelope and have already distributed over 12,000 of them, which is a fantastic first step and really shows how needed and easy this bill is to implement. But we're still pushing for the bill because it's important that this is true in every state or every city and town in the state. So that if you're driving from Waltham to Arlington, your blue envelope is understood and recognized, and to spread the word that more folks can request this and that it's a great tool. So we have the evidence that this works, it's out there, people find it successful, but we really still need to push to get to the bill passed this session. We actually already had the hearing on this bill and it is moving in the Senate. So if this is one you are interested in, this would be a great time to get involved. So definitely email me and I will loop you into the advocacy. Any questions on this one? Okay, great. The next bill is actually kind of a sibling bill. This bill around police training, also a Jonathan bill. And so many folks on this call. I feel like we are seeing so many of our strongest advocates here today, which is so great. So this bill requires in-service training for law enforcement and corrections officers about appropriate interactions with people with IDD and autism. The ARC actually previously led a bill that got passed that required a training for cadets, so newly hired police officers. But just like in any job, that continuing education is so critical. So we're pushing this bill, which would require, I think it's a 2-hour training about communication and sensory processing differences, appropriate interrogation and interview techniques, de-escalation, kind of all of these pieces that might come into play when a police officer is interacting with someone with autism in their community. This bill also really importantly includes guidelines for police about interacting with victims of or witnesses to crimes that may be different from interacting with a neurotypical person. And as it says in the first bullet here, there are connections to corrections officers here as well. We know that about, I think it's 25% of folks in prisons and jails across the country have some form of IDD or learning disability. So really making sure that our corrections officers have those skills as well to keep people safe and healthy in a prison or a jail. I think both of these bills are so critical in general, but particularly for neurodiverse folks of color who are already experiencing maybe challenging interactions with law enforcement. I think these are so important. And our state has really taken a lot of steps forward on police standards. So these bills are really important. I'll also just quickly add on this bill before I open to questions. Like I said, this bill is already happening for cadets, this training. And one of the great things about it is that the training is led by an ARC chapter, and individuals with autism are part of the training. So they're sharing their lived experiences, maybe what it feels like to be in these interactions, what has been successful, so that police officers can really connect and understand the personal implications of this. Any questions here? All right, couple bills left here before we wrap up. This next one around universal changing tables is also one that's been filed before. This one would require any new construction, reconstruction, or significant remodeling of public buildings to include restrooms with universal changing tables that would allow children, adults, elderly folks with disabilities or medical complexities to have that kind of assistance in a restroom, where right now there are often only the baby-sized, infant-sized changing tables that can't accommodate more than someone the size of a baby. So these the bill includes kind of size restrictions. They have to hold a minimum of 350 pounds. They would be adjustable height. So depending on your height, you could also get down to the floor, really opening up this ability to access the community for people who need this level of support with toileting, that they can get out of their home, enjoy their community, without that indecency of not having somewhere to get that assistance. The bill also includes that when they're installed, there would have to be appropriate signage so people know they exist. Say your public library would include a universal changing table. You need to know it's there, right, in order to access it. So signage in the building, as well as a directory of across the state, where are these tables, so that you can plan accordingly with your loved one and your family. This bill is supported by the Massachusetts chapter of Changing Spaces, which is a national organization that's leading this work across the country. So really great partner there. And of course, the bill includes restriction or exemptions for historical buildings or places where it's just not feasible, but really tries to get this in as many public spaces as possible. So this is one that there's a lot of support for. Been having conversations about maybe installing one in the State House itself as an example of how critical this is as the place where people can access their government. So really hopeful on some movement on this one this session. Any
Hey, Nora,
questions?
can I add? I
Yeah,
was
yeah.
at the Baltimore airport a couple of weeks ago and was overjoyed to see universal changing rooms at the airport. Also stalls that were floor to ceiling, so somebody who's trans has a little more privacy when peeing. But it was really exciting to see. I didn't take photos. I decided that was a little creepy, but I was pleased to see it.
Yeah, that's so great, Mary. Thanks for offering that. Yeah, I think, even if you or your loved one are not someone who needs help with this support, I think we can all understand how your life would be really limited by not being able to go out because there isn't a facility with a universal changing table in your town or your city or in the places you like to go. So this is one that we're really pushing, and there are other states that have done it. I wonder if where you were, Mary, was one of them. I don't have the number off the top of my head, but it is not a new concept. Okay. The last one we're going to talk about in detail today is the Archaic Language Bill, which you probably, if you are a close follower of the ARC, have heard us talk about a lot. We really tried to get this done at the end of 2024, but were unfortunately unsuccessful. This is a really critical bill that would replace offensive phrases and words in Massachusetts state laws, such as the R word and handicapped, with more person-centered language, like person with an intellectual or developmental disability. 40 other states almost all have already done this, as well as the federal government. It is a long bill because the way our laws work is that we have to change every single instance where an outdated word or phrase is used. So if you look at the bill, it feels super overwhelming. It's like 70 pages, but simply, this is what it does. It just changes, updates these phrases that are so offensive and are still in our state laws. This one already had the hearing. We are really, really pushing for early movement on this one. There's been a ton of research that's gone into this to make sure that any places where the change happens, it's not affecting access to services. It is simply updating language to more person-centered and fair language. Any questions on this one? Okay. All right, so those are our top priority bills. We also have this list of bills that we have endorsed. When we were doing our process this year, we wanted to differentiate between bills that the ARC was maybe leading the advocacy on and ones that we were uplifting the work of other organizations. We are all in this together, right? And every organization is prioritizes a little bit differently. So these are the bills that we are also supportive of, also pushing on, but maybe don't take as much of a leadership role in the work. I'm not going to go through these all just in the interest of time, but this list is also available on our website. So if any of these bills really stand out to you, let me know, and I am happy to connect you to our advocacy or the organization that's leading it. I will just flag that the second to last bill here, an act relative to affirming and maintaining equal access to public education, some really exciting movement on this one. Just for some background, this one codifies some really important federal education protections that are being actively rolled back in DC for students with disabilities and immigrant students. So this would codify those into state law so that if and when they're rolled back federally, we still have those protections here in Massachusetts. This language passed in a different vehicle in the House. It was an amendment to a larger bill, and we are currently pushing an action alert, which maybe Katerina can throw in the chat, or I can when I'm done talking, to get the Senate to move on this. So if you haven't already, please today do this action alert. This is such an important one for the protections that it would ensure, but also as a statement of Massachusetts is not going to cave to these changes at the federal level. So would encourage folks to do that. And again, if any of these other bills feel interesting to you or you want to talk more about, just let me know. Okay, we're going to pause in a minute for full questions, but I'll just share some quick resources. Of course, our action alert system, which you can scan this QR code to access. On our website, we have a full page on our legislative platform that includes detailed fact sheets on each bill, contact information, tracking information to see where it is in the process, as well as plain language fact sheets that have a blurb that's really kind of simple, digestible on each bill. On the MA legislature website, you can also find the, which we link to on our website, you can find the exact bill language, information on the hearings, and again, tracking information. And then as I said earlier, we have 15 total priority bills. I just talked about 5 super quickly. We do not expect you to be a super passionate expert about every single bill. No one has capacity for that. So we want you to really think about which of these stand out to you, either for your own personal situation, a loved one, your professional experience, and let us know what those are so that we can really loop you into the advocacy. For example, now that I know that Mary had that experience with a universal changing table, if I ever need a story about this working and being successful, I might give Mary a call and say, I need you to go talk to this legislator or testify at this hearing and talk about that experience. So now is the time to be doing that work and making those connections with us because these hearings are coming fast and furious, and movement on these bills can also happen fast. So would encourage folks to just take a minute today, think about what those are, and let us know. All right, I will stop screen sharing so we can all see each other and go through questions. So please feel free to either raise your hand or just yell out or throw in the chat your questions, and we'll take them one at a time. Oh, and thank you to Katerina for putting that action alert in the chat. That's super helpful. Any questions? I see so many folks on here who have testified recently. So if anyone also wants to just offer a little bit about what that experience is like, in case people are maybe nervous about doing that for the first time, that'd be great. Herb, I see you're unmuted.
And yeah, Nora, I guess I don't have a question, it's more a comment. I was going to say that for anyone who is considering testifying for the first time, I know that experience can be intimidating for a lot of folks, and how to think about what you're going to say in 3 minutes. That's the really difficult part, by the way. And I'm happy to offer anybody some help there who hasn't done it before. It's a great experience if you have the chance, and it's a you're you're really at a supreme seat of advocacy there if you have a lot of legislators sitting there listening to you. Uh, I always relate the story. Leo got me in front of the Joint Ways and Means Committee one time to testify. It was my very first testimony in the Gardner Auditorium, and so it for me, I'm kind of a trained sales guy, so it wasn't as intimidating, but I think it can be intimidating for a lot of folks. But you get in those situations, and that's why you're an advocate, is to kind of be in those situations. Those are the big games, and so I'm happy to help anybody who's thinking about it or anything like that.
That's great. Thank you so much. And yeah, Javon put a link in the chat, which I was on my note list of things to do and I forgot. So really appreciate that, Javon. That Mass Advocates for Children is the one leading this education bill advocacy and have been really phenomenal in getting this done. And they're doing a day of action at the State House. I think that's next week. So definitely sign up in the link that is in the chat. It'll be wonderful to have lots of people there. And I think you get a t-shirt if you go. So that's always a good draw. And I'll just quickly follow up on Herb's point that those testimonies are so critical when the hearing is scheduled. You can do it in person at the State House, virtually, or in writing, but it's also not the only way to advocate. So if that feels a little too intense, or getting to the State House is hard, or the timing doesn't work for you, again, you can do that written testimony. You can also email your legislators and say, I'm a constituent and this bill really matters to me. I want you to advocate for it on my behalf. And as Herb said, many of us on here are happy to help you kind of walk through that process, or even think through maybe which bill is most kind of timely for you to work on. So definitely don't hesitate to reach out. And I see another comment in the chat from Heather that yes, a new state rep will be sworn in next week from the Taunton area. Her information, I think, will be added right away, but we will definitely check on that. And we have a letter ready to go to her to kind of welcome her to the State House with our priorities and information that we'll send as soon as she gets sworn in and has an official email address. And then we'll try to meet with her as well. So Heather, if you want to join in on any meetings or outreach, we'd love to do that with you. So definitely shoot me an email and we can do that. Questions, and I'll put my email in the chat as well. All right. Well, if there are no other questions, we'll give you your the rest of your oh, great. Awesome, Heather. We'll chat for sure. We'll give you some time back today. Again, we'll be sending out the slides and recordings from all three of these webinars within the next week or so. Really appreciate people tuning in. Lots of work to be done at the state and federal level, but we are ready to go and need all of you to be active in this as well. So please reach out. Anything we can do to be of help or provide assistance, would love to. And yes, the link in that Javon just put in the chat, Javon, we should hire you. You're like so helpful with this, is to target a particular state senator who is the kind of the decision maker on at this moment on this education bill. So if you live in Fall River, Freetown, Somerset, Swansea, Westport, Lakeville, or Rochester, definitely you want to share this with your community. And we'll be doing some more outreach. Javon, maybe we can chat about this offline too, to those communities through our action alert system. All right. Thank you all so much for being here. Do reach out with questions, and we're looking forward to working on all of these bills with you. Thanks, everyone.